Welcome to the GBV AoR Helpdesk webinar on harnessing technology to address GBV and emergencies. My name is Sarah Martin, and I'm the moderator of the GBV AoR Community of Practice. And we're co-hosting this webinar today with the IAWG Sub-Working Group on GBV. So thanks to them for providing the technology and the technical support to get us online here. We'd also like to thank the GBV AoR Helpdesk for the opportunity to learn more about their latest evidence digest. So this is a series of webinars that we host on the GBV AoR Community of Practice to build capacity for those who are interested in responding to GBV and emergencies. This webinar will be recorded and it will be hosted on the IAWG website and the GBV AoR website. Stay tuned to the end of the webinar for more information on the Community of Practice and on the IAWG Sub-Working Group on GBV. So with that brief introduction, I'd like to turn it over to Laura Searles-Martineau from the GBViE Helpdesk to tell us a little bit more about the Helpdesk. And we will be taking questions at the end of the webinar. And if you would like to type into the chat box your questions, I'll keep track of them as well. So with that said, let's turn it over to Laura. Thanks, Laura.
Hi. Okay, good morning, everyone. Thank you for that introduction, Sarah. So I manage the GBV AoR Helpdesk, and I'm just going to take a few minutes to tell you a bit more about the Helpdesk and why it might be of interest to you. So the GBV AoR Helpdesk is a technical advisory and research service for humanitarian actors working on GBV risk mitigation, GBV prevention and GBV response at the global, country, regional and field level. In terms of who runs the Helpdesk, the GBV AoR Helpdesk is managed by myself, and I work for a consulting firm called Social Development Direct, and we manage the Helpdesk on behalf of the GBV area of responsibility. The Helpdesk itself is staffed by a roster of senior, gender and GBV experts with a broad range of expertise which covers GBV coordination, GBV case management, the clinical management of rape and psychosocial support, women and child-friendly safe spaces, access to justice, safe and ethical data collection and management, protection from sexual abuse and exploitation, GBV risk mitigation and multi-sectoral interventions, and how to work with national and local actors. So as explained, the Helpdesk is managed by myself on behalf of the GBV AoR, and we're staffed by a roster of senior gender and GBV experts with a very broad range of expertise. In terms of what services the Helpdesk offers, we offer primarily two demand-led services. The first is rapid program support. The GBV AoR Helpdesk can provide rapid technical support on GBViE coordination and programming in line with international standards, guidelines and best practice. And the GBV AoR Helpdesk can also carry out research. We can carry out global literature and evidence reviews and produce high quality written reports which highlight best practice in GBV in emergencies programming and also help signpost you to relevant tools and resources. In terms of what else the Helpdesk does, in addition to providing support following these requests, we also produce what we call quarterly research, learning and evidence digests. And what these are is they are field-friendly thematic summaries of the key evidence, resources and tools in relation to GBV programming and other sectoral areas such as livelihoods and cash transfers, for example. Through the Helpdesk, we also produce guidance notes, which are in-depth guidance notes on best practice in GBV and emergencies programming and policy engagement in relation to current and emerging issues. So the webinar that we're hosting today is with regards to a guidance note on harnessing technology to enhance GBV prevention and response in emergencies. And we're soon to be publishing another guidance note, which will look at how we prevent and respond to GBV in the context of natural disasters. In terms of who can use the help desk, well, the good news is everyone can, provided they're a humanitarian actor working on GBV risk mitigation, prevention, or response. So what we mean by that is the help desk is a service provided by the GBV area of responsibility to staff working for UN agencies, INGOs, civil society organisations, women's rights organisations, so that we can help build the capacity of humanitarian actors engaging in GBV prevention, response, and risk mitigation work. In terms of some common questions, sometimes people will ask, do I have to pay to use the help desk? And the answer is no. It's absolutely free to use the help desk. You don't have to pay to receive technical support or indeed to use the research service. So it's a fantastic resource, particularly for those smaller organisations who perhaps have more limited budgets. Great thing about the help desk is you can get support from one of our senior gender and GBV and emergencies experts, and it's completely free of charge. Another common question is whether it's confidential if you use the help desk. And yes, it is. We're not going to report back to your organisation if you've asked for particular guidance or advice. The only people who will know if you've used the help desk are myself in my capacity as the manager, and then also what we call the Help Desk Steering Committee, which comprises 1 to 2 representatives from UNICEF and UNFPA. So that's my quick introduction to the GBV AoR Help Desk. If you need some support on GBV and emergencies programming, we'll be sharing our contact details through the webinar. The help desk is normally available Monday to Friday, 9:30 to 5:30, and we try to respond to you within 24 hours. If anyone has any questions, they're very welcome to ask. Before I'll hand over to Sophie to talk about the guidance note on GBV and emergencies and technology.
And I'll do a brief introduction of Sophie as well, so if you don't mind, Sophie. So it's my pleasure and honor to introduce Sophie Read-Hamilton. Sophie's calling us in today from Sydney, Australia. She's a GBV specialist with over 20 years experience in preventing and responding to violence against women and girls, working for governments, NGOs, and UN agencies in humanitarian and non-emergency contexts. Sophie's been at the forefront of GBV work in humanitarian settings and is passionate about ending violence against women and girls and promoting women's rights. And I met Sophie in Sierra Leone back in the day, so I can tell you it's all true. We'll also be joined by Dr. Vandana Sharma, who's a global health researcher at the Harvard T.H. Chan School of Public Health with expertise in impact evaluations, randomized controlled trials, and capacity building in development and humanitarian contexts. Okay, I turn it over to you, Sophie.
Hi, everyone. Thank you so much, Sarah. Good morning, good afternoon, good evening. It's really lovely to be with everyone today, and thanks for making the time to join us as we take a look at this issue of technology and GBV in humanitarian contexts. And thank you also to our co-hosts who we've already heard a little from, in particular the GBV AoR Community of Practice and the IAWG GBV Sub-Working Group, and also apologies for the technology hiccups, ironically, that myself and others experienced. I'm wondering if we might be able to jump forward a couple of slides, if that's okay, to our very kind and helpful facilitator. Thank you so much. And maybe if we could jump past this one and go to the next one as well, that would be terrific. Thank you. So, yeah, perfect. Thanks so much. No, forward one is terrific. Thank you. So I'm going to talk briefly, and I'm aware that we're now running over time. So I'll try to not talk too quickly, but I'm going to look at, in line with the product that Laura mentioned earlier, how technology is currently being used in GBV prevention, mitigation, and response in emergency contexts. Some of the emerging practices that we're seeing, some of the lessons and in using technology to address GBV that are surfacing and present, and then fourthly, what to do, what we need to think about when we're starting to either use, introduce, or scale up technology to address GBV. At the end, I'm not sure that we'll get time for that. They're in the guide. So if we don't get to the recommendations, I think it's helpful to start by recognising that technology is playing a growing role in humanitarian contexts as elsewhere, with great potential to transform how humanitarian agencies deliver assistance and interact with the people that they serve. There are growing numbers of examples of technology being adopted and adapted by humanitarians, by people affected by humanitarian crises, and by non-traditional actors in humanitarian settings, such as the private sector, which is something we'll touch on again a little further down the track. The world used across countries to address GBV. Governments, NGOs, activists, and
Sophie, we're losing your vocals. It's kind of coming in and out.
To improve reach and access of, oh wow, that's no good at all. I wonder why that is. The irony of technology, Sarah, is that any better? Are you hearing me now? You know, I feel like I'm totally lost now.
No, much better.
Okay, great. Thank you. All right, super. Let's power on. So we're seeing the rise of technology in humanitarian settings and more generally in GBV work. Over 1.5 billion women around the world now own phones, including in low and middle income countries, and with over 1 billion in low and middle income countries now having access to the internet through phones, giving women and GBV survivors unprecedented access to digital tools and platforms. So we're definitely in a changing landscape. Let's take a look at how technology is currently being used in GBV programming, and if you wouldn't mind taking us to the next slide. So I just want to start by making clear that the examples that are given both here and in the guidance note, firstly, they're not exhaustive. Trust me, there are new apps and software and other innovations emerging all the time. And further, their inclusion in the guidance note is not necessarily endorsement or recommendation for them. They are being used to illustrate how GBV's being used. So I'm going to quickly first look at technology uptake in efforts to strengthen GBV programming systems and capacity. And starting with research, we're seeing a real increase in the uptake in particular of digital research tools, smartphones, computer tablets in particular, combined with new research software applications that are being used in a variety of contexts, including humanitarian contexts, to collect data for GBV assessments and for M&E purposes. So there's clear benefits in the use of digital research tools, including faster and more cost-effective data collection and analysis, improved data quality and improved data safety. But importantly, digital research tools are also proving to yield different types of data about GBV than traditional research methods. So, for example, audio computer-assisted self-interview tools and tablet-based software such as SenseMaker are enabling individuals to anonymously record responses to surveys, questionnaires, etc., and are eliciting different types of information from women and girls using them. And in particular, they're eliciting more sensitive information that may not otherwise be disclosed through face-to-face research methods. Moving on from research, we can see technology being used in GBV information case management systems globally. So the GBV sector has long used technology to try to improve and systemize our information management. As folks will be aware, the GBV IMS database was rolled out many years ago to try and improve efforts to standardise collection and analysis of GBV incident data. Recent advances in software and mobile technology are currently being harnessed to further enhance the capabilities and functionality of the GBV IMS, with a new generation of software enabling collection, storage, management and sharing of incident and, importantly, case management data, both on and offline, and that can now be used on tablets, computers, mobile phones, accommodating different able to be used in offline modes. There are also a number of national development actors, including governments, are trialling technology-based approaches to GBV reporting, referral and case management, facilitating better access to survivors to information and support services. And I think it's really relevant, particularly in countries that are vulnerable to disasters, where governments are already up and running or establishing these systems. Humanitarians need to be looking at how we can engage with and support and harness these technologies during emergency response. So another really key area where technology is being used in GBV is in workforce capacity development. The GBV sector has been leveraging e-learning and other web-based technologies for many years to build capacity of our workforce. And there are lots of examples of online platforms, web-based collaboration, learning tools to build our knowledge, to build our skills, to build our connection, coordination and competencies to try to improve the quality and reach of GBV programs. There are lots of examples of e-learning. The GBV AoR community of practice is another great and salient example, as is the GBV AoR Helpdesk, remote technical support that you heard a little about earlier from Laura. So there are some of the newer developments over the last kind of 5 to 10 years in the use of technology to build our capacity. But in addition to that, we're increasingly seeing rapidly advancing smartphone capabilities facilitating real-time and field-based mobile staff training, guidance and supervision, even in low connectivity settings. And I won't go into any specific examples here, much as I would love to, but I know that we're running a few minutes behind. So more information on each of those examples is available in the guidance note. If we could move to the next slide, that would be terrific. Thank you so much. So I'm going to quickly talk now about how technology is being used in response, how it's being used to improve services and supports for GBV survivors in humanitarian and other contexts. So obviously, we all know about helplines. They've all been around for many years and increasingly are being used in fragile contexts and countries and humanitarian settings. And it is mobile phones that are now enabling helplines to be used by humanitarian agencies, in particular settings where access to affected populations, but also barriers to women accessing services exist, and where there may be a lack of infrastructure, as in health services, psychosocial support services, and other humanitarian and non-humanitarian infrastructure in order to deliver services. So in these contexts, technology is enabling remote service delivery, with services provided particularly via mobile phones, but also through chat and SMS functions, as well as the traditional talk function of a mobile phone. And obviously remote service delivery models enabled by technology can be particularly effective to meet the needs of marginalised and at-risk populations that may have less access to mainstream services. There are an increasing number of smartphone applications for survivors that are aimed at giving women and girls information about their rights, connecting them with locally available support services, facilitating safety planning, and giving direct access to trained professionals through apps. Some apps even include safe virtual spaces for survivors to share their stories with each other and to access peer support. There are many examples, and again, given our time limitations, I'm not going to go into them now, but would encourage you to take a look at the many different apps that have been developed and are being used. An area that hasn't impacted as much yet in GBV is mobile health technologies, with mobile health and telecommunications rapidly transforming many aspects of healthcare delivery in developing and low resource settings, including humanitarian contexts. While there has not as yet been as much uptake of mHealth for GBV survivors in humanitarian settings, there are some emerging examples of technologies being used to support health workers in the identification, documentation and management of GBV survivors, including in the context of conflict-related sexual violence. And you can find more information about Physicians for Human Rights app called Medicapt, which is a smartphone app that's aiming to help physicians undertake forensic examination, compile medical evidence, take photos, injuries, and securely transmit the data to relevant folks, particularly within the justice system for prosecution. There's also some evidence of the emergence of technology-assisted approaches to psychosocial support, not specific to GBV work, but more broadly for populations in humanitarian settings, with mobile tools being developed to facilitate diagnosis and detection of mental health issues, and for providing online SMS and phone-based delivery of psychosocial support, including self-help programs for individual and groups of survivors. And again, there are some interesting examples that you can find either looking online or in the guidance note. We might move on to the next slide, if that's possible, where we can talk around the uptake of technology into GBV risk mitigation globally and in humanitarian contexts. So there are many digital and other technologies currently being used in efforts to reduce GBV risks and to improve women and girls' safety across a variety of contexts. So people are probably very aware or familiar with some of the mapping software and applications that are being used in lots of different countries to document, map and publicise information about GBV incidents and patterns, which is aimed at both helping individual and groups of women and girls safe, but also mobilising community and wider action to address GBV. So HarassMap's one of the best known examples, and it uses interactive online mapping, social media and mobile phones to map and document and encourage mobilisation against GBV. There are also examples of digital mapping and mobile phone technology being used to reduce GBV risks in humanitarian contexts. In Mexico, the GeoChicas, which are a group of feminist cartographers, use OpenStreetMap software in the aftermath of earthquakes in 2017 and 18 to map and share data on women's safety in informal shelters. They also created a database about women's safety issues and GBV reports to help improve safety measures and shelter provision for future disasters. There are lots of smartphone apps that are aimed at improving the safety of individual women and girls by providing information about GBV, enabling users to alert others and seek assistance when they feel unsafe or in imminent danger. Safety pin is a notable example, and it also enables users to undertake safety audits of the areas they're passing through, which are then marked as safe or unsafe on a visual map once the data is uploaded from their app. In humanitarian contexts, we know that displaced women and girls, even just having a basic mobile phone can increase their sense of safety, as they know they can use it to call for help if they need it, and even access a torch on a mobile handset can help make women and girls feel safer moving around camps, communities, etc. at night. So humanitarian agencies have been innovating with technology-based solutions to GBV for many years. People will be familiar with the use of cooking technologies and solar technologies that aim to help women and girls be safer and to reduce risks in a variety of contexts. But more recently, humanitarian actors have been looking at and trialling the use of mobile money and other mobile assistance and how it might be used to mitigate GBV risks, especially and including those related, for example, to travelling long distances to collect payments or other resources, goods or services. So that's a new innovation in terms of GBV risk mitigation in humanitarian settings. If we could move to the next slide, please. I could talk quickly about the use of technology in GBV prevention. So technology has great potential globally for preventing GBV through its use in public and community education and mobilisation, through providing a platform to lobby and advocate for legislative changes and for policies that will end violence and promote equality, and by helping catalyse greater social and economic empowerment of women and girls. A couple of examples: women's rights organisations, activists, governments and others are using social media and other platforms to educate, to spark debate, to mobilise and to campaign against GBV. With some initiatives such as Me Too, which I'm sure everyone's heard of, catalysing viral conversations both nationally and internationally. So new technologies are providing a way of reaching millions of people with new information, raising awareness, promoting dialogue, debate and connection about GBV and about the rights of women and girls. Women and girls' social and economic empowerment and its relationship to technology is another interesting and emerging area. So in development contexts, ICTs have been shown to facilitate women's access to credit, markets, business information and networks, and provide income earning opportunities, in some contexts actually directly being shown to improve women's economic well-being. In displaced settings, cash assistance delivered to women with mobile money and blockchain technology is being trialled in efforts to support women's financial inclusion, empowerment and agency through increasing their access to financial services and control over their assets. And UN Women and WFP have recently partnered to leverage blockchain technology to enable refugee women to receive and transfer financial assets on a blockchain network. If we could move to the next slide, that would be terrific. I'm going to talk quickly now, moving on to what are some of the emerging good practices. We've just had a very quick overview of some of the ways that technology is emerging in GBV prevention, mitigation and response, and through analysis we're able to look at what are some of the good practices that are surfacing. So one of them is, unsurprisingly, there is a need to prioritise and plan for safety. Although we have no sound and solid evidence base yet on which we can develop good or best practice guidance for using technology in GBV programming, and there are really good efforts underway to try to generate evidence, most interventions are really still at trial stages. And that means that we really don't as yet have a really sound or solid understanding of what the ethical, safety and other considerations are in the introduction and use of technology, different types of technology in different contexts for different purposes. So a good practice is that, as with all GBV programming, we need to really prioritise, plan for safety and consider the potential harmful impacts of technology on women and girls, on the communities, on staff and agencies before we even get started, and then throughout assessment, design, implementation, monitoring, etc. So prioritise and plan for safety. Second good practice that's emerging is the importance of introducing or using technology in GBV programming, basing it on a really sound understanding and design that are context sensitive, based on existing infrastructure and systems, and that reflect and address the circumstances, experiences, realities and needs of women and girls, their communities, and that consider women and girls' access, control and use of technology. So designed for the context. Again, many of these practices aren't new to us, but we need to make sure that we are applying them very carefully in the introduction of technology. Use evidence-based approaches is a third one. We really need to remember that technology is just a tool. Technology is not a solution. Technology provides us with a new tool or set of tools to improve or enable an intervention or a program or a campaign. Technology is not an intervention itself. So any intervention using technology must really be evidence-based, must use evidence-based good practice approaches to GBV prevention, mitigation and response. While we may not have evidence-based approaches to technology, we need to make sure that we ground all technology interventions or enabled interventions in the evidence base that we have already for GBV prevention, mitigation and response. We need to use human and user-centered design. These are newer concepts to us in the GBV world. Human-centered design is an innovation concept that is an approach to creating solutions for problems and opportunities by focusing on the needs, behaviours, emotions, etc. of the people that the solutions will serve. This means involving end users, including women, girls, staff and others from the get-go. This improves the likelihood that whatever we're trying to do, any technology will be appropriate, acceptable, user-friendly for women and girls, and is much more likely to have more effective outcomes. Test and learn, another good learning or good practice, that we need to test and learn about the feasibility, the value add, the usefulness of different technologies in every context. Just because something works in one place doesn't mean it works everywhere, and the needs and capacities of women, girls and staff will also be different context to context. It's something that we sometimes struggle with in fast-paced, moving emergency contexts, but we have to be ready to test and learn. Monitoring and evaluation. I mentioned a moment ago that we really do not as yet have a sound evidence base in technology in GBV prevention, mitigation and response. So it's vitally important that all innovations involving technology are really carefully monitored and rigorously evaluated so that we can assess their benefits, their impacts and their risks prior to them being scaled up, introduced in other contexts, but also so we can contribute to the development of an evidence base about what works, where, why, and how. If we could move to the next slide, that would be great. Thank you so much. I am actually not going to go through these in a lot of detail because we are quite short on time, unfortunately, but there are a few really salient challenges that emerge in looking at this area. I've mentioned already the lack of evidence at this point on the benefits, impacts and risks we really do not yet know, can technology be transformative for people and for humanitarian actors? There's some literature that says information communication technologies are transforming the lives of people affected by crises, but really there's a dearth of actual evidence on that, on what the positive, negative impacts are. So it's a challenge for us that we need to overcome. Another one is around data privacy and protection. As humanitarian and other actors collect more and more different types of digital data about affected populations in humanitarian contexts, issues of data privacy are arising, as they are elsewhere around the world. The issue of the rights of people in humanitarian settings regarding the use of data generated by and about them is also surfacing, and something that we need to pay attention to. Digital data privacy is challenging the traditional concept of humanitarian protection, and a number of researchers have suggested that getting data privacy wrong in humanitarian contexts may have serious and even life-threatening consequences for affected populations. So it's something we need to really pay attention to. Gendered access control and use of technology, I'm sure, as no surprise to anyone, is a challenge. Technology, including mobile phones, the internet, they might be widespread in lots of contexts, humanitarian contexts, but as with other resources, access control and use of them is gendered. Research and experience across humanitarian settings constantly shows us how gender limits and shapes women and girls' access to and control over and use of technology, and that is also the case even more so for different groups of women and girls, such as those with disability and other vulnerabilities. Technology-related GBV is another critical issue, that's a challenge that is surfacing. Again, it is not unique to humanitarian contexts, but it is one that we need to make sure as GBV actors that we are fully across. Because while technology is maybe changing responses to GBV and our programs, interventions and approaches, it's also changing women and girls' experiences of violence. Technology facilitated GBV is an emerging challenge globally. And we really need to think very carefully around how we understand it, how we manage it, and be ready to address it if we introduce technology in our programs. So if we could move to the next slide. I'm conscious that we are running out of time due to the technology gaps at the beginning. So I'm not going to spend a lot of time on each of these. I would urge you to have a look in the guidance note for more detail on each of them. But some of the considerations for us as a community and as practitioners and as agencies moving forward, if we're going to introduce or scale up technology and GBV interventions, is that we need to prioritise and safeguard women and girls' safety and rights absolutely as a priority at all times. We need to invest in women and girl-centred design. I know I mentioned human-centred design earlier, but one of the few experts working in this field of the intersection between GBV technology and humanitarian contexts pointed out to me we really need to be more than human-centred. We need to be specifically women and girl-centred and put women and girls at the centre of design. Resourcing is another critical consideration for scale up, and this is not just money, although money is one. Other resources, including time, are really critical. And I spoke to one person involved in the development of an app that's now being used globally, and it has taken them 10 years to design and roll out and test this app. So technical innovation takes time, experimentation, adaptation, and collaboration, which all require financial, human, and other resources. If we could jump to the next slide, please. So new capabilities and partnerships. I don't have time to go into this, but it's a really interesting and important area for us to think about. not only do we as GBV and humanitarian actors need new capabilities in this field, but there are new actors and partnerships. The private sector, financial services, telecommunications companies are very much in this space and working in this space, and we need to think through what those relationships and partnerships look like moving forward. And in particular, another point I have on that slide is around the development of shared principles and standards across all of the different actors that are now engaged in technology innovations for GBV work, and the very different objectives and principles and values that we all bring to this as humanitarians, as private sector, etc., need to be addressed. So I am going to not speak any longer because I would really hate to take up all the time. If we could just go to the next slide really quickly, if you wouldn't mind. There are some recommendations set out in the guidance note that I hope will be helpful for individuals and for the community, the GBV global community moving forward, to look at how we best move forward to safely introduce, test and evaluate technology within GBV. I have a few other key messages, but I'm not going to share them now. You'll feel free to get in touch with me if you wanted to read the paper. But I think it's probably a far better idea that I hand over right now, so you can actually get a case study, a taste of what it actually, the application of technology to GBV programming in a humanitarian context looks like in practice. So I'm going to stop, say thank you, and welcome Vandana on to talk to us about the podcast for IPV programming. Thank you.
Great, thank you very much. I'm really delighted to be here and to share some of the lessons from our project in Ethiopia. So if you wouldn't mind moving the slides forward to the first slide related to the podcast project. Okay, next slide, please. Great, so I will try to keep this short as well, because it would be nice to have the opportunity to have time for some questions at the end. So I'll just give you a little taste of this project, which is being implemented in Dolo Ado, Ethiopia, over the period of 2018 to 2019 with a number of key partners, including Women in Health Alliance, Ethiopia, the Addis Ababa University, Harvard Medical School, and Fondation Hirondelle. Next slide, please. And so we're working in refugee camps along the Somalia-Ethiopia border. There are about 5 camps in the area, and our project has been implemented in one of the camps called Boklomayo Refugee Camp, where there are approximately 40,000 Somali refugees residing. The project really focuses on intimate partner violence, which, as we know from existing evidence, intimate partner violence is the most common form of gender-based violence in humanitarian contexts, but there is limited evidence on effective IPV prevention interventions for displaced populations. Next slide, please. And so with funding from the World Bank and the Swiss Development Cooperation, we undertook this project, which aimed to develop and test an innovative approach to prevent intimate partner violence using low-cost technology to empower refugees to create and disseminate local solutions building on the Somali tradition of storytelling. So at the heart of the project was the development of a series of podcasts called Unite for a Better Life. And these were co-created together with Somali refugees and tackle topics such as gender, healthy sexuality, conflict resolution, household task sharing, sexual harassment, as well as chat use. Chat is a plant that is consumed in the Horn of Africa that has stimulant properties, And based on our research, has been found, the consumption has been found to have increased due to displacement, and as well it contributes to intimate partner violence. So each of the 16 podcast episodes includes a variety of content, dramas, interviews with key experts and community members, debates, and as well there are sort of take-home exercises or activities to try at home. Next slide, please. And so basically, the sort of different steps for this project are outlined here. We worked with refugees within the camp and provided training in digital storytelling, interviewing, and editing. And then together with these community members from the refugee camp, provided mentorship to enable the creation of this series of podcast episodes. And then the podcasts are broadcast at listening centers that we set up in the camp. Each listening center is a site that's easily accessible, that's safe and private. And the sort of goal eventually, once proven effective, would be to allow individuals to actually download the different episodes right at the listening centers, and then they could share them peer-to-peer with their friends, family members, and others. And therefore, you know, this approach has the ability to scale up pretty rapidly at a very low cost. For the purposes of our pilot now, we are not allowing the downloading and sharing because we want to test it first and make sure there aren't any unintended consequences, and also to assess potential effects in terms of knowledge and attitudinal change. So we are collecting data right now, pre and post intervention, to help us identify some of those changes. Next slide, please. And so the approach that we're using is really centered on engaging community members to be part of the process. They have been instrumental in terms of creating different components of each podcast episode, such as the dramas. But ultimately, it's the individuals that we trained and that we were working with from the camp who have gone out, recorded all the content, and edited each episode together. And that has been a very sort of empowering process for these individuals. So I've just included a quote here on this slide that one of the podcasters was sort of reflecting on this transformation. And he said, you know, this was a great transformation for me because, you know, in the very beginning, I didn't even know about podcasts. I remember on the day of the interview, I asked what a podcast is, and I looked around the room and I told them I had never heard of it. But now I can go out with my mic, I can record voices, I can edit, and I can produce very fantastic audios. Now I'm a great podcaster. Next slide, please. Next slide, please. Great. And so, oh, sorry, one slide before. And, you know, a number of sort of practices that emerged in the guidance note, I think, have been part of our project. So I just highlighted a few of them here. And I've already spoken about some of them, such as, you know, measuring unintended consequences, which I think is really key for an intervention like this. We certainly don't want to be putting people at increased risk of violence. So we are tracking that as part of this pilot study. I've spoken about the user-driven approach. One thing I wanted to just really quickly touch on is sort of building on and generating evidence. There are, you know, significant evidence gaps related to IPV prevention in humanitarian contexts, and even more so with respect to using technology as an approach to prevent IPV. And so, you know, we are using our project as a way to gather data through the pilot study, but also this project builds on a number of years of previous research and programming that we have done in the camp. The 16 episodes, each episode draws on an in-person IPV prevention program curriculum that we have developed over the last 4 or 5 years, both in a non-humanitarian context and then adapted it for this setting in Doloado. So I just wanted to emphasize that contributing to the evidence base is an important goal of the project. So next slide, please. And then lastly, I just wanted to really quickly mention a couple of the challenges we have had. One is the use of technology in a very low tech setting. There isn't radio, internet access, or even mobile phone that's phone network that's readily available in the camps. As we've been piloting the episodes and obtained feedback, especially from women, a lot of them have talked about the fact that it's the first time they're listening to audio files like this, or the first time even using headphones, as an example. And so we really adapted our approach, setting up listening centers where people could come in and listen if they didn't have their own mobile phones. There was also a number of other things I've listed here, which we don't have a lot of time to go into, but I will say the sensitivity of topics was definitely an important consideration. We're navigating taboo subjects such as sexual relationships, religion, and a number of other topics that are obviously very sensitive. So we did, through the user-centered approach, have local input into the content, but also as we were developing each episode, gathered community members to get their feedback on different parts of this. So I will ask just to go to the last slide for my section here. And I've got my email address there as well. So if there are other questions for me, do not hesitate to reach out. So I will pass it back to you. Thank you very much.
Thanks so much, Sophie and Vandana. That was really fascinating. As we've reached the end of the hour, we had a little technical difficulty at the beginning, ironically, so we won't have time to answer the 2 great questions we got from Lee Ashley and from Gaia, but we'll post those on the community of practice. Can you put up the next slide, Scott? One more. So if you're interested in the help desk, this is how you get in touch, right? So you just send an email to inquiries@GBViE helpdesk.org, and they can get in touch. They can help you and support you. Laura gave a nice summary at the beginning, but it is free of charge and it is open to everyone. And can you put the next slide, please? And then if your co-host today, on behalf of Scott, who has been pulling all the strings and levers in the background to get us together here from the IPPF with the Interagency Working Group on Sub-Working Group on GBV. You can get more information from them on their website here. Also, the recording of this podcast will be there. And also from me, on behalf of the GBV AoR, I'm your co-moderator of the Community of Practice along with Beth Van. You can always reach us on the gbvcop@gmail.com to join our happy little group of GBV and emergency specialists. We host webinars on different topics. If you have a topic you'd like to talk about or hear about, please reach out to us. And if you'd like to join, just send a message and we'll add you to the group. So on behalf of the IAWG Sub-Working Group on GBV and the GBV AoR, thanks a lot for listening for us, and we'll talk soon. Bye-bye.